What if your best health is at the intersection of modern science and ancient wisdom? I'm Dr. David Cherian. On my show, we bridge the gap between Eastern and Western medicine to help you live longer and finish your story. Welcome to the Convergence. Welcome, everybody. I'm Dr. David Cherian. I am a board-certified physician and a licensed acupuncturist practicing in Houston, Texas. I started Houston Acupuncture and Primary Care because I saw a gap in our healthcare system and in our healthcare philosophy that I wanted to fill. Carpal Tunnel Syndrome is talking about numbness, tingling, pain, and weakness in the hands and wrist caused by entrapment of the median nerve. The median nerve is one of the major nerves of the hand, and it runs right down the center of the wrist. And it passes through this narrow tunnel that's surrounded by the transverse carpal ligament on top and then the carpal tunnel bones behind it. What happens is that pressure can build up inside this tunnel and it causes pressure and squeezing of the median nerve. And that's when you get the symptoms of pain, tingling, numbness, weakness. You can also lose hand grip strength, which is one of the big things that bother patients when they come to our clinic. In Western medicine, when it comes to medications, the most common things doctors start with are your over-the-counter pain medications. So things like Tylenol, ibuprofen, naproxen, Aleve. That's a little bit about it from a Western perspective. Let's go into some of the questions that we usually see in our clinic when we're talking about carpal tunnel syndrome from an Eastern perspective. First question, can acupuncture and herbal medicine help with the pain, tingling, numbness, and weakness in my hands? The answer is yes. That is the goal of our treatment process. We're not trying to treat numbers or x-ray images or nerve studies. What we're trying to do is to help you feel better. For my patients, usually on the first visit, I try to quantify the severity of their symptoms. I'll usually ask them from a scale of 1 to 10, how bad is the numbness or tingling severity in your hands? And I might ask questions like, how many times a day are you dropping items? Are there particular items that are too heavy for you to hold or too difficult for you to hold? And then as the treatment progresses, usually over several weeks, at every visit, at every follow-up, we go back to those same questions. And I ask, now how is your pain level from 1 to 10? Most of our patients see improvements in these areas. So acupuncture and herbal medicine, we found at our clinic, does help our patients. The next question, will I feel better right away, or does it take a few treatments to work? The answer to this is it varies. I'd say about half of our patients notice some improvement after the first treatment, and the majority of patients are going to feel better after about 4 to 5 treatments. But again, it depends. It depends on how long you've had the problem. Like if you've had this problem for years, it's probably going to take a little bit longer. And it also depends on the complexity of your disease from a Chinese medicine perspective. And that's totally different from a Western medicine perspective. You might think you're in good health, or you might think you're in really bad health, and your Chinese medicine diagnosis may be complex or it may not be as complex. And that's something that I analyze and look at in the clinic when you come for your first visit. Usually at the first visit, when I'm done with doing the evaluation, I try to give patients an estimate of how severe their case is and how long I think their particular case may need before they start seeing improvement. Most of the time, I recommend for a brand new patient who I have not seen, who I've not evaluated, to anticipate at least 3 to 6 months. If you get better at the first visit, that's great. But I don't want you to come in expecting that because it might not be your case. I try to set up reasonable expectations for a new patient. Another point that I try to emphasize to patients is the benefits of Chinese medicine to your health, doing acupuncture and herbal treatment. It goes beyond just symptom relief. We're not just trying to get the numbness and tingling to go away for a few hours like you were taking a pain pill. That's what Western medicine is doing. What we're trying to do is get to the underlying root problem that's causing you to have this carpal tunnel syndrome. And that's what really gives lasting, sustained relief. Oftentimes, in a Chinese medicine perspective, the symptoms of carpal tunnel are really just a manifestation of a more deeper underlying health problem. What we're trying to do in our clinic is try to find what is the root underlying problem that's going on in each patient. And if we can treat that root problem, not only are the symptoms like the numbness, the tingling, and the weakness going to get better, but it's going to get better in a more definitive and sustained way. All right. Our next question. Can Chinese medicine help me avoid surgery or cut down on pain meds? Yes, that is one of the main reasons that patients come to see us. They're not getting enough relief from their splints or physical therapy or medications, and they're looking for something else. We see patients who have been recommended for surgery and they are trying to avoid it. That's a common reason that patients come to us. And in many of those cases, we are able to help those patients so that they no longer need surgery. One of our goals is to help patients reduce and even completely be able to stop their medications. Some of the common pain medications that you need for carpal tunnel syndrome, like ibuprofen, Aleve, naproxen, these are medications that have side effects. You can get gastric ulcers from them. You can have kidney damage from them. They're not medicines that you want to take for a long period of time. And most of our patients, they don't want to be dependent on those medications. Our goal when you come to our clinic is to get you off of long-term medications when at all possible and ideally avoid surgery. Usually on the first visit, I'll ask my patients, are you taking any medicines for your carpal tunnel syndrome? And patients will tell me how much medication, what medication it is, the dosage and the frequency. Then again, during follow-up visits, I'll track how much medicine over the past couple weeks have they been taking since they started the treatment. A lot of the times, patients will naturally decrease their pain medication and they don't even realize that they just started cutting back on it because they were just naturally feeling better. I like to ask that question because it's one of the more objective ways that we can measure that a patient's symptoms are getting better. It also helps patients to kind of appreciate the progress that they made since we started treatment. All right, our next question is, how do you look at carpal tunnel syndrome through the lens of Chinese medicine? So in Chinese medicine, when I think about carpal tunnel syndrome, I think about the organs that are running through the affected area. All of the internal organs have channels or pathways that course throughout the whole body. They go through the trunk, through the arms, and through the legs. And specifically with carpal tunnel syndrome, there's a few organs that go through the wrist and the hand, and that's the pericardium, the lung and large intestine, and then the Sanjiao meridian. Earlier, I talked about how carpal tunnel symptoms usually affect the central to the radial side of the hand, like the thumb, the pointer, the middle, and the ring finger. In acupuncture, those areas are governed by a few key channels. The first one is the pericardium, and the pericardium runs along the path of the median nerve right down the center of the palm. And then you have your lung and large intestine, which run along the radial aspect of the arm. And then you have your Sanjiao meridian, which runs along the posterior midline of the arm and hand. Those are the four key meridians that run through the area that's governed by the median nerve. When a patient comes in with carpal tunnel symptoms, I ask them, what kind of symptoms are you having and where exactly are you having the problem? And that tells me a little bit about which channels are involved and specifically which organs are involved in their case. A lot of times, other organs may be contributing to the problem as well. It might be a different organ that's affected first, and then that is causing a secondary effect on the pericardium, the lung, the large intestine, or Sanjiao. And if that's the case, then we have to go back and treat the initial organ that was causing the problem. That's why when you come to my clinic, I'll ask a lot of questions about your overall health, not just about carpal tunnel symptoms. Sometimes patients are a little surprised why they're being asked questions about their sleep or energy or fatigue or heart symptoms when they came in for carpal tunnel syndrome. But what I'm trying to do is I want to get a full picture of every patient's health and see if there's other issues that might be contributing so that we can get to the right diagnosis. All right, our next question. Are there acupuncture points or herbs that help with nerve healing and inflammation? For most patients in my clinic, I will use a wide variety of points, usually a combination of points on the arms, the legs, and the trunk. And again, that's because we're trying to treat the whole body. But that being said, there are a couple common points that we use for carpal tunnel syndrome, and I'm going to give you an example of two of them. One of them is pericardium 6, which is located just below the transverse crease of your wrist. So your transverse crease is right here, and you go just a little bit below that. And it's right between the two tendons in the middle of your wrist. So if you feel your wrist, you can feel these two tendons, and pericardium 6 is right there between those two tendons. The other point is Sanjiao 5, and the Sanjiao meridian goes along the back of your forearm and hand, and kind of similarly, a little bit below your wrist crease, you're going to go a little bit farther down, about at the level of pericardium 6, and it's right there between the radius and ulna bones in the middle, and that is Sanjiao 5. I will usually use both of those points in combination with other points, and when patients come in, I usually show them where those points are located. I might show them how to massage it at home during that first visit. Massaging is not as potent as necessarily doing the acupuncture and inserting it in needles, but it can give a little bit of relief at home as well and be a little bit of help in between treatments. Next question is, how will I know if the treatment is working for me? Compared to Western medicine, Eastern medicine is very different. In Western medicine, we're oftentimes tracking lab values and numbers, but in Eastern medicine, the real emphasis is, are you feeling better? One of the main ways that we know that the treatment is working for you is if your pain and your symptoms are improving. If we talked about things at your first visit, like how severe your pain is, how many times a day you're dropping things, and then you notice that those things are getting better, that's a strong indicator that the treatment's going in the right direction for you. Or if we talked about the fact that you're using maybe Tylenol 3 times a day or ibuprofen twice a day, and now you only need it once a day, or you're only using it every other day, that's a strong indicator that the treatment's working for you. And then from my end, I also look at physical exam findings. In Chinese medicine, that includes checking your tongue, your pulse, and based on my analysis, I can also get an indication of whether your body is responding to the treatments and whether your health is getting better in the deeper aspects, even though you may not yet feel changes in your symptoms or you are feeling better. I can also verify that based on my analysis. So our next question, do you treat deeper things like kidneys or digestion, even if the pain is just in the wrist? Yes, a lot of times the pain you're feeling in the wrist, it might not just be a wrist problem from a Chinese medicine perspective. So what do I mean by that? In Western medicine, we think about carpal tunnel syndrome like it's just a wrist problem. You have your carpal ligament and you have the carpal bones and the median nerves run through it, and it's the pressure causing it. It's just a problem that's located right there in your wrist in the carpal tunnel. But in Chinese medicine, we look at a patient's health and their disease more holistically. So a problem you're feeling in your hand or your wrist, it might not be limited or caused by just something right there. It is connected to the internal organs in your body as well. And they all interact with all of the organs of the body. The health of one organ influences the health of another organ. Yes, we often have to treat deeper things like kidneys or digestion or liver or lungs or any of the organ systems because that could be what's the root problem causing the wrist pain. Even if the pain is just in the wrist, we don't look at it as just a wrist problem in Chinese medicine. Our next question, I have other health problems in addition to carpal tunnel syndrome. Does acupuncture and herbal treatment help with those as well? This is a common question that patients have when they come to our clinic. They may come just for carpal tunnel syndrome, but when we go through their history, they start mentioning other health problems. They might mention things that they've been formally diagnosed with, or they might just mention other symptoms that they have, but they haven't actually been formally diagnosed with anything. It could be trouble sleeping, it could be back pain, fatigue, a wide variety of different things. One of the things that I try to explain to patients is if we get to the root of your problem, if we really get to what's the underlying cause of the carpal tunnel syndrome, there's a good chance that same root issue is also contributing to a lot of the other symptoms and problems that you're having. So it's kind of like this. Imagine your house has a foundation problem. You might notice your floorboards or your tiles start cracking, but it doesn't stop there. The walls might shift. You might have sheetrock that breaks. You might noticing roof problems. A whole cascade of different problems can happen because of one underlying issue. And it's similar in our health. When one organ starts to go off track, it can impact neighboring organs. It can cause a whole cascading effect, and you will see a variety of symptoms begin to develop. Our treatment is holistic. We're really trying to get to the root cause. And when we do, we're oftentimes able to help a number of other symptoms or problems that our patients have been having as well. The next question, can you show me a few acupuncture points that I can press or massage myself? I'm going to show you two common points that I use for carpal tunnel syndrome, and I mentioned these briefly earlier. The first one is pericardium 6, and it's a little bit above your wrist, right between the tendons here. And if you feel along the forearm, you'll notice the two tendons that just run parallel to each other, and you want to massage right in between there. And that's pericardium 6, and it's one of the commonly used points for carpal tunnel syndrome. And the other point is at a similar level is also the one I mentioned earlier, Sanjiao 5. It's on the back of your forearm, about the same level as pericardium 6, below the wrist crease and between the radius and ulna bone. You can just massage that point as well, and that's the point that travels along the back of that forearm and into the head. Those are two of the common points we use. When we do acupuncture, we're putting the needle directly into the channel. It goes deeper, it's more potent, it can penetrate directly, and it gives a better effect. But even just massaging these points at home can give you some relief for a lot of our patients, and it's something you can do in between treatments. All right, our next question, have you treated other patients with carpal tunnel syndrome? What kind of results have you seen? Carpal tunnel syndrome is one of the relatively more common conditions that we see in clinic. A lot of people have it, especially nowadays with the amount of typing and computer work that we do. It is very common. And in the vast majority of cases, we're able to help patients avoid surgery completely. Most of the time, we can get their pain levels down and cut down how much pain medicine they're using, and oftentimes get them off of pain medications completely. Our last question, do you mix Western and Chinese medicine when you treat carpal tunnel syndrome? My approach is that I usually recommend patients to continue whatever Western medicine treatment that they were doing before they started seeing me. For carpal tunnel syndrome, it's usually over-the-counter pain medications that patients are taking. And I'll explain to patients that as the treatment progresses, they should naturally need those medications less. And as they feel they need it less, they can taper it off as they feel comfortable doing and cut back on those. When it comes to surgery, most of the times I'm recommending patients to do a trial of acupuncture and herbal medicine for at least a few months before deciding to go ahead with surgery or proceed with it. That gives us time just to see if we can get them to a better place and hopefully avoid surgery completely. Of course, that can vary from patient to patient, and we usually recommend our patients to also just decide that in conjunction with their surgeon. So that brings us to the end of our show for today. Thank you for sticking around to the end. I hope this information today was helpful for you as you consider different treatment options you have for carpal tunnel syndrome. If you found today's show helpful, please like and subscribe. That goes a long way for us. If you're interested in learning more about what we do, you can visit our website at www.houstonacupuncture.com. You can also send us an email at office@houstonacupuncture.com, and we'll see you next time.